Did you know that many people unknowingly take medications that might be harming their kidneys? The truth is, your kidneys are crucial to overall health, filtering waste and balancing fluids, so keeping them healthy is essential. However, certain medications you may be taking, even right now, can silently damage your kidneys over time, especially if used improperly or for long periods. For instance, common pain relievers like ibuprofen or certain antibiotics, often taken without much thought, could be putting your kidneys at risk without you realizing it. But don't worry. In today's video, we'll explore 7 common medications that can potentially harm your kidneys and share practical tips to help you safeguard these vital organs. By the end of this video, you'll understand which medications to be cautious of, how they impact kidney health, and, most importantly, what steps you can take to reduce potential harm. So, stick around, as this is information you don't want to miss. Before we dive in, I'd love your help with 2 quick actions. First, if staying healthy and informed is important to you, please hit the like button below. It's a small gesture, but it allows us to reach more people with helpful knowledge. Second, consider sharing this video with someone you care about, as it might make a real difference in their health journey. Let's dive into the 7 medications that could be harming your kidneys. First on our list are nonsteroidal anti-inflammatory drugs, NSAIDs, medications that many of us have likely used at some point to manage pain from headaches, muscle soreness, or arthritis. Popular NSAIDs include ibuprofen, Advil, naproxen, Aleve, and aspirin. These drugs are widely available and effective at reducing pain and inflammation, but they can pose significant risks to your kidney health, especially if used frequently or in high doses. NSAIDs work by blocking enzymes responsible for producing prostaglandins, which are chemicals in the body that contribute to pain, inflammation, and fever. While reducing prostaglandins helps ease discomfort, prostaglandins also play a critical role in maintaining adequate blood flow to the kidneys. When their production is suppressed, the kidneys may receive reduced blood flow, which can result in acute kidney injury. Over time, this restricted blood flow can lead to long-term kidney damage, including chronic kidney disease, CKD, and even kidney failure in severe cases. People with existing health conditions, such as diabetes or high blood pressure, face an even higher risk of kidney complications from regular NSAID use. If you find yourself reaching for NSAIDs often, it might be beneficial to discuss alternative pain management methods with your healthcare provider or limit NSAID use to protect your kidney health. Reducing your intake or exploring other pain relief options could be a simple but powerful step towards safeguarding your kidneys in the long term. Second on our list are proton pump inhibitors, PPIs, a class of medications commonly prescribed for acid reflux and heartburn. Drugs like omeprazole, Prilosec, and lansoprazole, Prevacid, work by significantly reducing stomach acid production, offering relief from the discomfort of acid-related symptoms. While effective, these medications can carry risks, especially with prolonged use. Research has shown a link between long-term PPI use and an increased risk of kidney issues, including chronic kidney disease, CKD, and acute kidney injury. One way PPIs can harm the kidneys is by causing a condition called acute interstitial nephritis, where inflammation develops in the spaces between kidney tubules, impairing kidney function. The effects can be subtle at first, and many people may not notice any symptoms of kidney damage until significant harm has occurred. If you rely on PPIs for frequent heartburn or acid reflux, it's worth discussing with your healthcare provider whether continued use is necessary. In many cases, lifestyle changes, such as dietary adjustments or eating habits, can provide relief without the need for extended medication use. Taking steps to reduce or eliminate your dependency on PPIs may be beneficial for long-term kidney health, helping you manage reflux while also protecting your kidneys. Third on our list is lithium, a well-established medication for managing bipolar disorder and other mood disorders. For decades, lithium has been a mainstay treatment, helping to stabilize mood swings and providing essential mental health benefits for many individuals. However, despite its effectiveness, lithium can have adverse effects on the kidneys, particularly with long-term use. One of the primary kidney-related risks of lithium is a condition called nephrogenic diabetes insipidus. In this condition, the kidneys gradually lose their ability to concentrate urine, leading to excessive thirst and increased urine production. Over time, this can strain the kidneys, potentially progressing to chronic kidney disease, CKD, or, in severe cases, end-stage renal disease. If you are taking lithium, it's crucial to monitor your kidney health closely. Regular kidney function tests can help detect early signs of kidney strain or damage. Additionally, staying adequately hydrated is essential, as dehydration can increase the strain on your kidneys. Collaborating with your healthcare provider to manage both your mental health needs and your kidney health is key. Together, you can develop strategies to minimize kidney risks while benefiting from the stabilizing effects of lithium on mood. Fourth on our list are diuretics, commonly known as water pills, which are often prescribed to reduce fluid retention and manage conditions like high blood pressure, heart failure, and sometimes even kidney disease itself. Commonly used diuretics include furosemide, Lasix, hydrochlorothiazide, and spironolactone. These medications are vital for managing various health issues, but they can also place extra strain on the kidneys, especially with long-term use. Diuretics work by increasing urine output, which helps the body eliminate excess salt and water. However, this increased fluid loss can lead to dehydration over time, a condition that is particularly risky for kidney health. When dehydration occurs, blood flow to the kidneys decreases, and reduced blood flow can damage kidney cells, leading to permanent harm if left unchecked. Additionally, long-term or excessive diuretic use can disrupt the body's electrolyte balance. Imbalances in potassium or sodium levels can further impair kidney function and may result in serious health complications. If you're taking diuretics, it's crucial to stay well hydrated and have your electrolyte levels monitored regularly. Working with your healthcare provider to manage hydration and electrolyte balance can help you reap the benefits of diuretics while minimizing potential risks to your kidney health. Fifth on our list is antibiotics, essential medications in treating bacterial infections. While antibiotics like penicillin, ciprofloxacin, and vancomycin are highly effective against infections, they can also pose risks to kidney health if misused or overused. Certain antibiotics have nephrotoxic effects, meaning they can harm the kidneys, especially when taken improperly. The kidneys filter antibiotics out of the bloodstream, and in some cases, this filtration process can put stress on the kidneys or even damage sensitive tissues. Some types of antibiotics, like aminoglycosides, e.g., gentamicin, can accumulate in the kidneys, leading to direct cellular damage. Over time, this stress can result in acute kidney injury, AKI, with the risk being higher in older adults or individuals with pre-existing kidney conditions. To protect your kidneys, it's important to use antibiotics responsibly. Always consult your healthcare provider before starting an antibiotic, and follow the prescribed dosage and duration closely. Avoid taking antibiotics for viral infections, such as the common cold or flu, where they are ineffective and unnecessary. By using antibiotics cautiously and only when truly needed, you can support both effective treatment and kidney health. Sixth on our list are ACE inhibitors, medications often prescribed to manage high blood pressure and heart failure. Common drugs in this class include lisinopril, ramipril, and enalapril, which work by relaxing blood vessels, thus reducing the workload on your heart and helping to lower blood pressure. For many people, especially those with diabetes or chronic kidney disease, ACE inhibitors also offer kidney protective benefits by supporting stable blood pressure and minimizing kidney strain. However, ACE inhibitors can also have a downside when it comes to kidney health. These medications lower blood pressure within the kidneys, which can reduce their filtering ability, particularly if taken alongside other nephrotoxic drugs like NSAIDs or diuretics. This reduced filtration capacity can cause kidney function to decline in some individuals. In most cases, the benefits of ACE inhibitors outweigh potential risks, but it's essential to monitor kidney health while on them. Regular blood tests to check creatinine levels and glomerular filtration rate, GFR, are key to ensuring your kidneys are functioning well. By staying proactive about monitoring, you can gain the cardiovascular benefits of ACE inhibitors while keeping an eye on kidney health. Seventh on our list are antiviral medications, including drugs like acyclovir, tenofovir, and remdesivir, which are used to treat serious viral infections such as herpes, HIV, and COVID-19. While these medications are essential for managing life-threatening viruses, they can also have harmful effects on your kidneys. Some antivirals, such as acyclovir, can cause crystals to form in the kidneys, leading to blockages in the kidney tubules, which can result in acute kidney injury if not addressed promptly. Other antiviral drugs, like tenofovir, may cause long-term damage to kidney cells, potentially leading to chronic kidney disease with prolonged use. Given these risks, it's essential to monitor kidney function regularly while on antiviral medications, particularly if they are used for extended periods. If kidney damage is detected, your doctor may need to adjust your dosage or switch to an alternative medication to minimize harm. If you're prescribed antiviral medications, stay vigilant and maintain regular follow-ups with your healthcare provider. By doing so, you can ensure that any signs of kidney stress are caught early and prevent further complications. Now that we've covered the main medications, here are 2 extra bonus medications to be aware of. Number 8. Herbal supplements and kidney health. While many people turn to herbal supplements for their potential health benefits, some herbs can pose serious risks to kidney health. One of the most concerning examples is aristolockic acid, a substance found in certain traditional Chinese medicines and some other herbal products. Aristolockic acid has been linked to severe kidney damage and is considered highly nephrotoxic. When ingested, aristolockic acid can cause a condition known as aristolockic acid nephropathy, which leads to chronic kidney disease, CKD. This condition is often difficult to diagnose early, as the damage to the kidneys may go unnoticed until significant kidney function loss occurs. Over time, prolonged exposure to aristolockic acid can result in end-stage renal disease, ESRD, which may require dialysis or a kidney transplant. The use of herbal supplements that contain aristolockic acid has been banned in several countries due to its dangerous effects on the kidneys. However, these supplements may still be available in some regions or through unregulated markets. It's essential to be cautious when using herbal supplements, especially if they are not certified or regulated. Always consult with a healthcare provider before using any herbal remedy, especially if you have pre-existing kidney conditions, to ensure that the herbs you're taking are safe and won't negatively impact your kidney function. Number 9. Contrast dyes and kidney health. Contrast dyes, also known as radiographic contrast agents, are commonly used during imaging procedures like CT scans and X-rays to enhance the visibility of internal structures. These agents help doctors obtain clearer images of organs, blood vessels, and tissues, which is vital for accurate diagnosis. However, while they are essential for medical imaging, contrast dyes can pose a risk to kidney health, especially for those with pre-existing kidney conditions. One of the most significant risks associated with contrast agents is the development of contrast-induced nephropathy, SIN. SIN is a type of acute kidney injury that occurs when the kidneys are unable to properly filter the contrast dye from the bloodstream. This condition can lead to a sudden decline in kidney function, and in severe cases, it can progress to chronic kidney disease, CKD. People with conditions such as diabetes, high blood pressure, or pre-existing kidney disease are at an increased risk of developing SIN. Additionally, dehydration, high doses of contrast dye, or multiple imaging procedures may further heighten the chances of kidney damage. If you require a procedure involving contrast dye, it's crucial to inform your healthcare provider about any existing kidney issues. They may take steps to minimize the risk, such as using a lower dose of contrast dye or ensuring adequate hydration before and after the procedure. Now that we've covered the 9 common medications that can damage your kidneys, you might be wondering how to protect yourself. One of the best things you can do is stay hydrated. Proper hydration helps your kidneys filter out toxins and medications more efficiently, reducing the risk of damage. It's also important to monitor your kidney function, especially if you are taking any of the medications we discussed. Regular blood tests to check your creatinine levels and glomerular filtration rate, GFR, can give you a clear picture of how well your kidneys are functioning. Another key factor in protecting your kidneys is avoiding the overuse of medications. Whether it's NSAIDs, antibiotics, or proton pump inhibitors, using these medications excessively can increase the risk of kidney damage. Always follow your doctor's instructions, and avoid taking medications longer than necessary. If you are concerned about how a particular medication may affect your kidneys, it's important to consult your healthcare provider. They can help you adjust the dosage or even suggest safer alternatives that are less likely to harm your kidneys. Your kidneys are essential for maintaining overall health, and while they are resilient, they are also vulnerable to damage from certain drugs. By staying informed about the risks and taking proactive steps to protect your kidney function, you can help preserve your kidney health for years to come. If you found this video helpful, please give it a thumbs up and share it with friends and family who could benefit from the information. Don't forget to subscribe and turn on notifications, so you never miss a crucial health tip. Every small action you take today can have a big impact on your health in the future. Thank you for watching, and we look forward to seeing you in the next video.